Hi, I'm Dale Kurt. I'm delighted to be back for Mackenzie Health's Celebrating Patients 2017, More Than a Patient. In the following short video, you're going to hear from people who have either received care or are the loved one of someone who needed care. They're graciously sharing their personal stories to inspire others, whether that be them patients, a family member, or a caregiver, because we never really know when we're going to be in need of care ourselves. Join me now as we learn from these individuals, we celebrate their strength and resilience, and hear about their healthcare journey.
My name is Mei Lu. A few years ago, about 5 years, exactly 5 years, in April, I went to Mackenzie Health to do my mammogram. And the result kind of showed a little bit of a mass on my right breast. And then in July, we went back to my doctor and checked the result. Then they confirmed it was cancer. And then it was also confirmed I had uterine cancer. It was almost feel to me is a death sentence at that time. I felt like that. Well, in the Chinese culture, especially the elderly generation, nobody talk about cancer. Cancer, that means bad. Cancer means death. Cancer means you must have done something really bad and really in your life and you get cancer. So to me, that's wrong. That's completely wrong. This is nothing to be ashamed of. So far, I have clean checkup, but I still continue to be under care of the doctor, the two different oncologists. It really changed my perspective in life, and now I said, I take an early retirement, and I said, that's it. I'm not worried about work anymore. Now I want to pay back to the society, to the community. I do a lot. Now I do volunteer at the Mackenzie Health. I want to be part of this celebration is because I want to be able to tell people there's hope, and you have to be able to put your trust in the healthcare, because we are most fortunate living in Canada that we have a great healthcare system. I'm living right now and just live each day as its last. That's my motto, and I say, just be happy. And I'm very grateful for all the family around me, and you treat everything and every day the fullest, and you don't take anything granted. You really thank people. So I'm very happy.
My name's AndrewFerraro, and what brought me to Mackenzie Health is an illness that my mother went through and did not survive. We didn't come in knowing it was the end. She had been ill. She'd been diagnosed with stage 4 metastatic colon cancer in October of 2015. We were starting her on an immune therapy rather than chemotherapy. It was very hard because she did not tolerate any of the chemo or anything very well. It just wasn't good for her body. But she was a trooper. She went on, and standing at the kitchen sink, her hip broke because of the metastases. When we got to Emerge, she was in a lot of pain, as you can imagine, and not moving at all on the stretcher, and they had to, get her to radiation. And Emerge here is packed at all times, and this was a Friday. Late in the afternoon, and we were, standing room only in the middle of the corridor, her on a stretcher. So when we got the diagnosis of what it was, again, it was just one more thing that we had to deal with. It just seemed every corner we turned with her, there was another complication thrown in. And I had asked the nurse, because we knew we were in for a long night, and I said to her, she's been sick for 14 months. We've had a really awful time with complications. We've been in and out of hospital, a lot of wait times, a lot of pain. Is there anywhere you can put us that we're not in a corridor until orthopedics can see her? And so the nurse found a small room kind of in a ward area of Emerge with a door on it. and that's where they brought us. So that was the start of, wow, you know, like they really showed some compassion here for this poor woman who has been through the ringer in 14 months. We finally decided on a week before she passed that palliative was looking like the only choice that we were going to have left. She was not going to get to rehab. She was starting to fail. She had a kidney infection, like her body was starting to say, that's it, I cannot do this anymore. The problem was palliative had a waiting list. We needed as a family to have her alone. We couldn't be in a room where family members of the other person were, you know, joking and you're, you know, talking about the surgery and they're boisterous, and it's not their fault. That's just, we were not in the right place for her. And palliative was full, and the hospital was full. And hospice wasn't an option yet because she wasn't that close. Well, the coordinator on the 4th floor and the chaplain moved mountains, like mountains. They finally found her a private room very close to rehab, so kind of between rehab and palliative. And it looked onto the parking lot, it had sun in it, and we moved her there about 5 or 6 days before she passed. She was unresponsive at that time. And when we got moved down to that room, the nurse there, when we came in, she greeted us, she reassured us she'd had experience in palliative. She told us about all the medications that they were going to be administering. She gave us a brochure on what to expect. Palliative visited her because it was side by side. Every morning, whenever we needed any information, they were always there for us, always answered questions, phoned me. One of the palliative care doctors would be calling me regularly to give me updates on what she was finding. I mean, they don't have a crystal ball, so they can't tell you everything. But they tried to give us as much information as they possibly could. And again, that was something we weren't used to. We had a very positive experience in spite of the outcome, which was inevitable. And I felt like I could talk about it and share it with people because everybody in this hospital made a very difficult stage in life a little easier.
My name is David Chang. I live in Richmond Hill. I was admitted in the hospital in April 24th, 2016. And I was transported to the hospital by ambulance after I called the 911. I stayed there for about 10 days, but including 3 days in the ICU. The doctor diagnosed my sickness was called diverticular disease. I know nothing about it, but the thing is something problem inside my colon. Normally, bleeding is minor, okay, not like me, it's very severe. When I look back to my report, I've been transferred 5 units of blood. At that time, because actually this is just a number for me. I don't realize that how serious. But after 2 months, I went back to the surgeon, and he told me that, you know what, if you are 10 years older in your situation, normally you couldn't walk out from the hospital. That 10 days of experience, maybe for some people it's just nothing. But for me, I told you this is the first time ever in the hospital, and I can experience that so many professionals around you. So that's why I say I need to share this story, because my experience is with Mackenzie. So I think this is something that's important to me. Now I share every happiness, anything with my family members. I precious every moment I have here right now, and I want to share this is something that I feel something good to my life.
Hi, my name is Sabrina, and 8 years ago, my journey began at Mackenzie Health as I was diagnosed with several rare, complex autoimmune conditions that I will continue to face for the rest of my life. I grew up a dancer, set on being dance, set on living dance, set on doing dance, And being thrown into a completely different world where I had to give that up was horrendous. I mean, I went from dancing 6 nights a week to barely being able to get out of bed, and acknowledging that was so difficult. But having my parents and my sisters at the end of the day who know my struggle and who understand my struggle, having them believe in me and having them reassure me when we reach doors that have closed or, you know, difficult obstacles that we can't get through, having them remind me that they're there, that they understand that they won't stop until we get where we need to be. It means the world to me. It means the absolute world to me. And I don't know if I'll ever be able to thank them enough. I went from being the girl that was terrified of needles to being the girl that wants to be on the other side of the bed. I want to get into nursing. I want to work in pediatric oncology, but I want to be a nurse, and I wouldn't have ever come to that realization if it wasn't for my experiences and if it wasn't for all of this. So in some kind of crazy, weird way, it's a blessing. Being able to have these opportunities to tell my story and to share, you know, my symptoms and my conditions and my story, my hope is that it'll save somebody else. I want people to know that it's okay to have these things, and that even though it may feel like it, you're not alone in that. And having a hospital that, you know, has my history and that can go back on that takes a huge load off of a lot of the anxiety and a lot of the frustration and even fear that I have. It's almost relieving. It's like I can walk in there and expect relief. I can expect understanding, and I can expect that, you know, people are acting in my best interest. Every day may not be good, but there's something good in every day.
If you have a healthcare story to share with others, tell us about it at mackenziehealth.ca/stories. We may contact you to be a part of a future Celebrating Patients event. You never know, your story could be the one to inspire a family member or a patient who's on a similar healthcare journey. So please share your story with us today.